Shockwave therapy provides a host of advantages due to its ability to accelerate the body's natural healing processes. One key benefit is its capacity to reduce pain, making it a valuable option for individuals dealing with discomfort. The therapy also excels in promoting tissue regeneration by stimulating collagen formation, growth factors, and the development of new blood vessels, all of which contribute to the repair of damaged tissues. Furthermore, shockwave therapy effectively addresses inflammation, a critical aspect of healing, by decreasing it in the targeted areas. By enhancing blood circulation, the therapy ensures that nutrients and oxygen are efficiently delivered to the affected regions, facilitating faster recovery. Its positive impact on muscle, ligament, and tendon healing is noteworthy, as it aids in restoring optimal function in these areas. The therapy's potential in bone healing is remarkable, as it has demonstrated the ability to treat bone fractures, including stress fractures and fractures that have failed to heal on their own, without resorting to invasive procedures. Additionally, shockwave therapy's ability to activate stem cells opens up possibilities for significant tissue repair and regeneration, further enhancing its healing potential. In the realm of cardiac health, shockwave therapy has shown promise in enhancing cardiac function by stimulating new muscle growth in the heart following surgical procedures. Similarly, the therapy's cognitive benefits are emerging, particularly with innovations like Neurolift, which may improve cognitive function in patients with conditions like Alzheimer's disease. Overall, the diverse benefits of shockwave therapy make it an adaptable and potentially transformative treatment option across a wide spectrum of medical conditions and wellness goals. Shockwave therapy is a non-invasive method that uses high-pressure mechanical waves for the treatment of musculoskeletal disorders. It is widely used in rehabilitation, sports medicine, and orthopedics. It addresses trigger points by delivering high-energy shockwaves to the affected area. Its main benefits are rapid pain relief and restoration of mobility. Shockwaves are used to reduce inflammation, reduce fibrotic tissue, and stimulate tissue healing. Additionally, it has been shown to stimulate the production and activation of stem cells in the body. Shockwaves have biological effects on tissue repair. A sequence of high-energy sound mechanical pulses is performed at the injury site. This energy penetrates the injured tissue and causes an analgesic effect by intense local stimulation, releasing enzymes that act in reducing pain. A mechanical action that fragments local fibrosis. Shockwave can be used to treat joint pains, such as tendinitis and epicondylitis, on shoulders, elbows, and knees. The other musculoskeletal conditions that this therapy treats include plantar fasciitis, frozen shoulder, peripheral neuropathy, carpal tunnel syndrome, and chronic joint pain. Shockwave is one of the latest technologies in rapid recovery and long-lasting pain relief. Treatment is safe and is a great alternative for pain patients who want to avoid more invasive procedures.
Like every day I've been stretching like my hamstring at work, wherever, and it's like as soon as I bend right here, I'd feel like everything just pulling. Tighten.
More than a week, I had my surgery, and it's been a limp ever since.
Difficult to bend the knee, walking.
I can feel the weather change.
You can feel the weather change.
Feels like on the inside it gets like the muscle is really tight and I can't do a whole lot. My posture, I know I have bad posture, but when I'm sitting down, it just starts to ache. It feels like I just need somebody to get in there with their elbow and just like fully rub it out.
Well, I actually got the shoulder using a pole picker, picking fruit off the tree. That's what caused this.
Right.
I don't know what caused that.
Right.
You know, and then all of a sudden this, I mean, the pain was so excruciating.
Go back the other way.
Feels good. Feels really good, yeah.
I mean, because the hamstrings prevent you from doing, I mean, if your right leg, that's going to prevent your kicks. Yeah. And now that that loosened up, your kick should be a lot stronger.
Okay, awesome.
Yeah, they're gonna be,
I mean, I can feel it.
The goalie's going to feel it.
Yeah, see, now I can bend my leg.
Now you can bend your leg, go all the way up, huh?
Before I was doing kind of like stiff leg. Now I can do it.
Wow. Right after the first treatment, they noticed a difference. That's how I knew. When you said you couldn't put your leg out, I said, let's Let's try it.
And I'm pretty much going.
I know. How's your walk now?
Oh, it's fine now.
Now you've had tightness. It was painful.
Yeah, it's not.
Nothing.
I feel like I can just
go all the way. Yeah, you got your range of motion back.
Yeah.
Turn and face that way a little bit. Let's go the other arm. How's that feel?
It was all the way up there.
All the way up.
Before I remember it was like wanting to like stop right here.
Yeah, it was stuck. It was stuck. The whole capsule, we broke loose all the tendon attachments right there. Wow.
Feels really good. I feel like I can do things again.
Right?
Yeah.
Don't go tumbling.
Yeah, no, I won't do that.
Just checking.
I'm still a little scared to do that.
Yeah, but wow. Hand grip, much better. You couldn't open it before.
Nope.
And my gosh, I mean, check out this arm and this arm. Wow.
That's amazing.
You got one treatment and you're full range. Yeah, imagine after multiple.
You can't imagine.
No.
You know what I've been going through.
I know what you've been going through. I mean,